For people who are doing an HCG diet or any like extreme restrictive diet, when you state that you lose about 1 pound of muscle for every 4 pounds of weight that you lose,
Right.
correct?
Right. It's lean body, not just muscle.
Right, lean body.
But when you do that diet and you lose 20 pounds, okay, which could happen, and so you've lost, for every 20 pounds, you lost five pounds.
Muscle.
It's a
Lean
lot.
body mass.
Which
You
is
try to
bad.
get that back.
Yeah, it's a lot.
That is very hard.
Very
And to
hard.
regain it, especially if you're older, is going to be very hard.
So when in this country we hear malnutrition, we're thinking about somebody from a third world country,
Yeah.
right? You can have somebody who's overweight, has a lot of extra body fat, and is protein malnourished.
Absolutely.
Right?
It's common. It isn't
So
even
common.
unusual. It isn't unusual in this country.
Yeah. No, but the average person doesn't think so. So when
Right.
they see somebody who's overweight, they'll think, oh, this person is not malnourished, she's overnourished.
Right.
But with the wrong building blocks, and you need the protein. I think this is what's important. I really want to get to our patients.
Yeah.
How important, how much, who would build a house and not get cinder blocks?
Right.
You're going to build a house and you don't have the building blocks.
Right.
So this is the important thing I really want everybody to understand.